Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission: to provide medical professionals with the resources they need to learn from each other, and in doing so, improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics, including the Physicians in Training Day in the Life podcast series. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
Hello, I'm Dr. Chris Morse. I'm currently serving as president of the Southern Medical Association. And today I'm very honored that I have a chance to speak with three the top experts in the area of autism that will be presenting and having a roundtable at our annual meeting in October at the end of this month at the Southern Medical Association Annual Assembly. I'd like to welcome Dr. Anuja Mehta, Dr. Shirin Hassan, and Dr. Lisa Spector. And, first, one of the questions I'll throw out, and this is one that I think a lot of people really don't understand, is what is autism? I think that's, people use various terms. We obviously, we see people, the movies like Rain Man, which shows something, but not everybody with autism is a Rain Man type person. So how can we, really get an idea of what autism is?
So autism is a neurodevelopmental disorder. It's manifested in early childhood. It was first described by a psychiatrist working at Johns Hopkins. His name was Dr. Leo Kanner in 1943. And what he did was he described a group of 11 children who kind of stood out to him as being different on a different developmental trajectory. And the one of the main ways they were different is in their social communication, the social reciprocity. And so that was back in 1943. And over time, researchers and physicians working on autism have described in detail what it entails, what the criteria are. So the main aspect of autism is social communication deficits. And that's sort of, we see in a character in Raymond, like they're unable to sort of do a back and forth. They're unable to get nuances of communication, like sarcasm, or sort of pick up on nonverbal cues in communication. And beyond that, I would say there's a spectrum. It's a spectrum. So we have individuals with autism with normal intellectual function. And typically in the past, we've called them Asperger disorder. They might be math savants or really, really intelligent. And on the other hand, we could have individuals with autism with intellectual disability. There's also a range of functional abnormalities in terms of language. So we can have individuals with autism with normal language all the way to impaired language or nonverbal as well. The other aspect of autism that people may sort of recognize is restricted range of interests or stereotypical movements in kids or in adults. They don't like changes in routine, or you could have kids who want to wear the same outfit every day, etc. So those are some of the main features of autism, and it's a neurodevelopmental condition. It's genetic in nature. It does tend to run in families, but there's also sort of new genetic variants or mutations that can occur that can lead to autism.
Well, I think that's a good explanation. One question I have, it's sort of interesting. Over the years, we've seen how frequent autism occurs. And there are now some numbers that are fairly, surprising. And, one question I have is it becoming more common, or is it because we are identifying it better?
So that was one of the things that I looked at. What we do know from CDC data is that over the last 16 years, autism has increased in prevalence from occurring 1 in 150 children, this was back in 2000, to 1 in 54 children as of 2016. And it's probably going up now. I think that's an excellent question. We are better able to detect now. There are screenings in place. So children as young as 18 months get screened in a pediatrician's office with an autism scale filled out by parents. So there's better process now, and we are picking up children that are even mild on the autism spectrum. So we can provide them services. and their developmental trajectory as close to possible as they're typically developing siblings or peers. And then there's research out there looking at, environmental contributions of autism. And also there's another thing that people know about age. So parental age and that association with autism, the paternal age is there's some association with autism as well. So there's a lot of factors going on. And I think I would like to think it's probably a combination of a little of both, that we are better able to detect it early on with our screening tools and wide awareness. And also probably there are probably some elements in the environment that, may be contributing it more possibly.
I also wanted to add that I think there's increased awareness of it now in society as well. I think more people, know that it exists. They're more aware of it. I think pediatricians are more aware of it, as Anu just said, with the screenings at earlier age. But I've had parents that have raised that issue with me during, if they've come in for other assessments, for example, for ADHD or other things, they have raised a question of autism spectrum disorders. So parents are actually asking more and more about it. So I think that is another factor we might be seeing more as the awareness spreads and parents do ask questions about it. And take it to get, tested for, evaluated, or assessed. There is an increase in diagnosis, I think, from that perspective as well.
I will admit in full disclosure that I'm the father of a son who is on the autism spectrum. And so a lot of the things that I've seen over the years of raising him, I speak from a personal experience in many of these things. And, I've personally had the feeling, one of my opinions is that there's a difference between disability and handicap. Disability is the difficulty a child has. A handicap are the things that other people put in front of them that make the disabilities even harder. And I think one of the things we've seen is how many people who have stereotypes on autism. Some of the myths they have are what they can't do, what they can't, what they're able to accomplish. For instance, one person said, well, children with autism, they're unable to express any emotions or show love or have any, good friendships.
Hi, this is Lisa Spector. I think it's a very good point that you make. And I think, unfortunately, in the past, when people did not know very much about autism, they provided parents and caregivers with inaccurate information. And thankfully, we've come a long way. And we can really provide, which we do in our clinic every day, provide parents, especially the parents of children newly diagnosed with autism, that hope, and to help to instill that hope that kids with autism with evidence-based treatments can make tremendous gains, and they can oftentimes look like typically developing children when we give them the treatment that they need. And there's a wealth of therapies out there that help address some of the difficulties that they may be experiencing, whether that's speech and language therapy or occupational therapy, or as we all know, ABA therapy or applied behavioral analysis therapy, and social skills groups as well, to help. What we talk about is building their skills to help work on some of the things that are harder for them. But when they build those skills, it becomes easier. And again, they can look a lot like typically developing children over time when they get the right therapies.
And I agree with you, Dr. Morris. I think we also bring and put our own perspectives into things. I've had patients with autism who are actually okay having one friend or two friends. However, there's this burden from society, do this. And what my talk with parents is, as long as the child, for the most part, is feeling okay, is not showing a lot of anxiety or depression or other symptoms, and feels like they're functioning okay, you support that. You don't try to bring them totally to where you think they need to be or where they are. So I totally agree with what you're saying, that we also as a society put these expectations in some ways. And Lisa's right, early treatment and has made significant differences, because she sees the younger kids and I see more of the older ones. So I have seen the ones that they have gotten the consistent ABA and the speech and language therapies and all the support services that she talks about and she incorporates with the parents into getting. And I sometimes see the results and I'm like, well, yeah, you do meet some ASD characteristics, but you really, having a full conversation with them. I'm having them on, maybe anxiety meds, but they're functioning at a level that's so different what the parents have described. So I am actually seeing some of the benefits of the early treatments because I do see a little bit older kids than she does. But I also 100% feel like, and I talk to those children, and it's okay to be, as we sometimes say, use the word introverted, or we use different words, but my goal is for them to feel happy with who they are, to get the self-esteem that they need and kind of be where they are without me or a society judging them in some ways because of all the progress that they've made. So that's where I come from that perspective.
Well, I understand. I appreciate that. One thing that I've noticed when I was with my son was he had a best friend from first grade up through high school, and he could get my son to accomplish things that nobody else could. And so I wonder, is it the innocence of the children who basically see them as a person and overlook their qualms, their little quirks or whatever, that the adults can't manage?
I think so. I think it is that non-judgmental kind of approach, accepting them for who they are. I mean, children, middle schoolers not so much, but younger kids can definitely be very accepting and tolerant and will, be kind to these kids. And I think these kids flourish. I actually have a story with, I have a patient who has moderately ASD, but when his symptoms actually improved when mom had a baby, and so working, I guess he saw the baby and learning from the baby and played with the baby, so he actually got improved as this little child. His symptoms kept improving with the adding. So I think that does play a role. Is like with your friend, somebody who kind of accepts them for who they are and meets them where they kind of are at, and hopefully pulls them along a little bit more, but kind of meets them where they are at.
Mhm. One other thing I think that seems to be forgotten in a lot of situations is that autistic children grow up. They become adults. They are, one of the things we saw is when things start to, when unfortunately there are times when services end up and the person is stuck and they're sort of just like thrown out to the wolves, if you will. What can we do to educate adult physicians in how to manage and how to deal with autistic patients?
What part of my talk that I'm going to give is about comorbid conditions that are associated with autism spectrum disorders, which would be, the anxiety and depression. We can, and other issues that I can get into a little bit later if we need it at this point. And so for me, part of this is also helping adult providers. Two parts here. One would be obviously helping them manage the anxiety and the depression and the comorbid conditions, and the other is to be able to talk with these kids in the spectrum and how do you address them from the medical perspective, because like sometimes in their speech, rigidity and those kind of things. So to communication skills with the adult physicians with these patients would be, I think, an essential thing we would want them to learn. But part of it is there's no field. I feel when I transition a lot of my patients in Dr. Spector, she's younger developmental pediatrician, and a lot of adult psychiatrists are not very comfortable accepting these patients either. So I feel like there's no field particularly that is set to take a lot of these patients on. So I think educating primary care physicians and internists to be able to manage this patient is where we would want to be. And that's a tough call to get them to that level of education where they will meet these patients where they are. Now, again, remember, autism is a spectrum, right? So you obviously will have those intellectually disabled children, the nonverbal, and they'll still be, potentially can still be adults that are intellectually disabled and nonverbal versus the high functioning, which is what you indicated your son is, who's going to college, who is wanting to do, but he still has some areas that could need working on. But I 100% agree. That literally has been my struggle, is how we get the word across. And I think education is the key, maybe educating them what these patients, what these kids look like as they go from here to here, how much, to have some in their offices that can maybe communicate with them, having the families involved more in communications with these kids is where I see education is the key.
You bring up one thing, and this is something that I have seen, is that there are people, and when you can look at them, you can tell they have disabilities. One of the biggest problems with kids with autism is too many times they don't look like they have a disability, and that unfortunately it's by their actions or subtle things they do that show that they have the disability. But I think there are times when adults don't even recognize that they have difficulties. One of the issues in my family we face has to do with personal space situation. They don't understand the personal barriers, if you will, that other people do. They, my son, we try and stress on him. It's been easier during COVID because he's really been worried about it, but giving hugs to people and things like that. And I think this kind of thing sort of puts people off in some ways, but they don't realize that it's nothing bad or evil to them. This is just their way of showing, friendship and affection. How do we get across to the general people that this is not something that's evil and everything else? This is somebody who has a problem with understanding and processing interaction with other people.
Dr. Morris, is a very good point that you bring up. And as you're speaking, I'm thinking also in terms of children with disabilities, specifically autism, and their interaction with particularly law enforcement, for example. A lot of times law enforcement officers, like you said, may not recognize that somebody has a disability and may not recognize that a certain behavior that might be exhibiting or the way they're communicating is a manifestation of their disability, and not the fact that they're trying to avert law enforcement and sometimes they can escalate, unfortunately, into in a very stressful place for that child or adult with autism and a law enforcement officer as well. And so I think it's really important, to your point, that we educate people, and particularly those who work with people in the community, to understand what is autism, and that people may respond in certain ways, and it's not to be disrespectful, but it's part of who they are, and it's appreciating those differences.
There was a study that I read in the American Journal of Child and Adolescent Psychiatry, and it talked about among adults with disabilities, particularly mental disabilities, those with autism had the least employment rate. So it goes back to the point when you said when all the services are done with and they outgrow their 21, 22, they're often left at home with parents. And they have a hard time finding employment. And one of those issues goes back to what you're saying. The social communication piece, the nuances, is such an important key piece to successful employment. And I think in workplaces where there's not adequate education about autism, what that looks like, it can be a barrier for individuals with autism, adults, to get gainful employment and maintain it. And, especially, of course, those who are higher functioning. So I think that study kind of underscores the need for people to, again, be educated about autism, what it looks like, and that it is the inherent nature of the condition, which can highlight some of the communication deficits of people, and that it's not intentional, and how to accommodate them in different workplace situations.
And even in medical settings, I saw, and I think it was a similar study I saw too, Nija, that a lot of the medical illnesses are missed with them, so they actually have a higher rate of dying earlier and higher rate of medical illnesses that are not being picked up. I mean, that's, I think, across the board in patients with mental health issues, but it was definitely in the ASD because they're not able to fully even communicate maybe symptoms, and or physicians don't have the time, or you're seeing a patient every 10 minutes or whatever, and you don't have the effort you're putting in to really communicate with a patient that has communication difficulties to begin with. And so sometimes medical illnesses are missed much more frequently in patients with ASD as well.
I want to switch a little bit, change around a little bit, and talk about another issue, something that I've seen, and it has to do with myths related to treatment. I don't think a month goes by that I don't get an email from somebody talking about this dietary supplement, this diet, this issue, that issue. What are some of the things that when we talk about autism, may have some benefit behind them, and some which are totally full of baloney.
So I can tell you there's no scientific evidence behind hyperbaric oxygenation, chelation, antifungals, secretin, all these different things. I think patients and the parents in this population sometimes are desperate. And when people are desperate, they seek all kinds of alternative treatments, because I still have parents that will come in there, seeing me for ADHD-like symptoms or depression and thinking that I'm going to be able to, quote unquote, cure or fix the autism. And so my conversation always is, I don't have a medicine that I can give you that's going to cure and fix autism. So as you might be aware, there's 2 medications that FDA has approved for, and it's quote unquote irritability associated with autism, and which is risperidone and omeprazole. But that is it. So everything else is basically parents desperately searching for different options, from folic acid to vitamin D's to omega-3s. There's just all this, I see B12s, B6s, and there's just not any clinical data that truly backs up any of this at this point. Now, again, I will tell parents, if you're giving a multivitamin, these kids don't eat well or are very picky eaters. And so giving them nutrition, giving them vitamins could be a helpful thing. There was some study showing omega-3s can maybe help with some attention issues. So I will try to kind of lead them and guide them that way. But I think we need, as medical professionals, really need to kind of help these parents and say, no, these are people trying to take advantage of you when they're suggesting do all this weird things and all these odd different things. There's just for this talk, I did a lot of research hoping there was something great out there that I could sort of discuss new thing. There was a new medication that had made it to phase, I think it was 3 trial, valvaptan, but it was actually pulled by Roche in its phase 3 because they were not seeing a benefit. So there's one that's very early phase trial that I'll talk about at the talk that they are looking at to help with some of the social delays in autism. And it did show like transient improvement. However, there's nothing that is a fix or cure, except what Lisa constantly will reinforce is the ABA and the early therapies. That is what we want every parent to kind of walk up, because we do see tremendous improvement. From a nonverbal kid to talking, if they get those early, so that's why the early identification and early treatment is crucial in this thing, so that we don't get to the place where, a 14-year-old that's nonverbal and parents at that point are desperate and wanting to try all these different alternative treatments, which just, I wish I could say this is great and this is effective, and maybe someday there will be, but at this point there's not. So I, as a physician, would absolutely discourage families from trying something that is kind of crazy. There can be things we can potentially try, like naltrexone for biting. And so there's obviously psychiatric medications that I do have that I use significantly in lots and lots of my patients, treating specific symptoms associated with the autism, not the core autism, obviously, but helping with some of the aggression, helping with some of those other symptoms, OCD-like behaviors or tic behaviors. And medications can definitely help with those symptoms. And when medication helps with those symptoms, I think ASD can improve from that perspective, because we're clearing out the other stuff in a way, but no meds for autism. And I'm sure Lisa and Anuja will agree.
I think one other area that I think is missed a lot of times when we talk about autism, we talk about the autistic patient, but I think the families also suffer drastically. There are families that we could go to things, and there are times when there are things we've sort of felt excluded because of the fact, what are we going to do with our son? It's hard to find family members, even family members, to help watch over and take care of our son if we want to go on a trip or something like that. There's that fear when we travel. Should my wife and I, if we were to go on a trip without him, should we take separate flights so that if something were to happen to one of us, the other one would be there? And, I think, how can we get more help for the families so that they are, helped? And because I think it's a whole family disease. It's not just one that affects the child.
That's a good point that you make as well. You know, support groups can be tremendously helpful for families. There's can be respite services for families where qualified people can help to watch a child who has a disability. As Dr. Hassan mentioned, the ABA and ABA, applied behavioral analysis, being an evidence-based treatment for autism. And it's so important, and we emphasize this all the time for our families, that when children get ABA, it's important when they get ABA that the program that they're getting their ABA through has a parent training component to train the parents in the core components of ABA, and making sure any other primary care provider for that child also gets experience with ABA. It can be, it seems like a lot to learn initially, but once you delve into it, you realize it's very intuitive. Once you kind of learn the formula, and easy to implement those strategies, both for the caregiver and other people who might care for a child.
The other thing I always encourage parents and families is to see if there's any family support groups available for this, because other parents and families that have experienced this are going to be your biggest advocates and your biggest supports. I've actually had families where they've actually helped watch each other's kids at times when they've not been able to get, babysitters or other family members to step up. So I've actually had them step up because they kind of have learned how to deal with it and know how to deal with it. But I think education is the key, and then obviously the and it is a family thing. I mean, when we share this with parents that their child has this diagnosis, educating the family and expectations is critical. But I would recommend also having some sort of family support system in place to help the family and for you guys to make time for yourselves as well, because I think it can be very difficult to manage a child, especially a child that has even more severe intellectual disability or severe aggression and self-injurious behaviors. I have a family where the kid has done like $20,000-$30,000 worth of damages to the family home by breaking doors and windows and walls and those kind of things. So again, those parents need support. The child obviously needs help as well, but the family needs to also have that outlet, because they're with this family 24/7. So having your own mental health taken care of, making sure you're as in a healthy place as possible is essential in this as well. And as parents, you want to focus on your child, and parents do, right? You want the best for your child. So a lot of parents' energy and time gets focused into making sure the child is okay and not enough in making sure they're okay. And so my take home for a lot of parents is, you have to be okay to take care of this child. And so I really emphasize parental, emotional, and mental health with all the patients as well.
I just wanted to add that CARD, the Center for Autism and Related Disabilities, is a really great resource for families, where they often provide support groups for families, as well as social skills groups, parent trainings as well. AutismSpeaks.org is another really great website that people can find additional support through the help of other parents who have children with autism as well.
Well, I'm going to get a little personal. My son, one of the interesting things about my son is he has had what I've discovered is a pretty common thing among autism, and that's food issues. He's very selective in his food. One of the things I admit is that he would take a meatloaf that I made every day to lunch at school. And in order to become more social with his friends, he would share with 3 or 4, about half a dozen friends at his table, Andy's mints. And the Andy's Mint people, actually, his aide, his speech coach, basically wrote a letter to the Andy's Mints people. And in return for that letter, the Andy's Mint company sent 2 cases of Andy's Mints to his school so that everybody could share them with my son. And, one of the things is, though, one of the things as a result is I estimate I've cooked over 600 meatloaves over his school career. And, do y'all have any thoughts on, ways to combat that, especially in the smaller communities? One of the problems, I live in a smaller city. And while we've been very fortunate and we've had support and everything else, there is very drastically lacking much support for families and everything else. Some of the secondary groups, the support groups and everything else, especially in the smaller communities in the Southeast. We have a shortage of physicians in the Southeast in general. And unfortunately, that means that a lot of kids get left behind because the services aren't that well available. Any thoughts on what we can do to get them a little more spread out to everybody?
I think this is a tough question, Dr. Morris. I mean, I think it has to do with statewide funding and local funding. But as you have alluded, and I'm sure Dr. Spector, Dr. Hassan, we all see that children with autism have a very limited palate. Typically the kids I see, they only want to eat 3 or 4 different kinds of foods, and those foods don't include fruits and vegetables. So that's a big problem that we see in children with autism. One thing I've noted, though, is one of my child with autism, after intensive ABA therapy, now when I most recently saw their mom, said he's now eating some fruits. And that's been very, very nice. But I think to answer your question, I think it's a tough situation. For us in Central Florida, it's very difficult. And I know Dr. Spector is kind of also doing some research or survey on that accessibility issues of these services, but a lot of families are on wait lists that are very long, and children are not able to get the services they need. And part of it, I think, diet and eating is, I think, a part of it to teach them to explore and touch the textures with the foods and sensitivities, etc. So it's a tough question. Wish I had a simple answer, but
I mean, starting along with ABA, obviously, the occupational therapy or the feeding therapies at an early age is essential too. So I've seen, again, kids do a little bit better if they're started really early with different things put in their mouth, what the OTs do with the feeding clinics and feeding part. But that is a significant issue that we see with our spectrum kids and I think you're lucky that he eats your meatloaf because that's healthy eating. I've had kids only eat pizza from one place and the parents are having to get this one pizza. So actually you can maybe sneak in other things into your meatloaf. I'm not sure. But now that is a significant common problem. And that's why I guess I do encourage the multivitamins and making sure that they are getting nutrients the other way. But early treatment with an occupational therapist who specializes in feeding issue, I think would be really helpful in the long-term prognosis and introducing, one thing at a time. And I have seen successes in that if started early. But it is a tough thing.
It is very tough. I will relate a story. You all will appreciate this. He had started eating grilled chicken, and we told him that we were going to have grilled chicken at Buffalo Wild Wings, which is one of his favorite places to go. And we ordered the grilled chicken, and he took a look at the naked tenders, and his comment to me was, "Dad, I have a bad feeling about this." And which showed he also has been watching Star Wars movies a little bit. But I mean, now he loves. We've explored different sauces and so forth, so he knows which ones he likes more than others. Still getting him to go with more than cheese pizza, spaghetti and meat sauce, French fries and meatloaf it gets a little tough at times. But he has his likes and dislikes. He's told us that he is going to try some new things sometime, but of course, sometimes doesn't make it all that soon. Well, we've had a nice chat about everything. Do y'all have any other comments or thoughts or anything that you might want to share? Because I'm really looking forward to the roundtable we're going to have at the end of this month. I think that it's something that would benefit every physician, every specialty. And I think there are groups that maybe underestimate how much they would benefit from. And so I'm asking you all, do you have any other thoughts about, things that are important to everybody to understand about autism?
I just wanted to add, in terms of tagging on to what the previous question was, in terms of any kind of behavior change, it's always baby steps. And I think it's really important to remember that that is important to focus on the fact that we're just going to take little bitty steps at a time. There's going to be steps forward and there's going to be a couple steps back sometimes, and we're going to make some more steps forward, but it's little change at a time, and celebrating those little changes and promoting the positives could really help make a huge difference, whether it's feeding or toileting or sleeping, in any of those.
And I just want to kind of emphasize about 50 to 70% of patients with autism spectrum disorders do have another comorbid psychiatric disorder like depression or anxiety or ADD or OCD or other mood disorders, and identification of those and treatment of those can make functioning overall better. Again, we're not taking care in the cure symptoms, but we've seen significant improvement in some of our patients, just overall affect, overall even functioning, if we are able to treat. So I kind of want other physicians and parents to be kind of aware, just to not put everything, oh, he's autistic, so everything that's going on is because of the autism. Because every study has shown that there's a significant comorbid potential. They have, you mentioned the disordered eating, but sleep disturbances are present in 70% of our ASD patients. And if we can get them to sleep better, and again, whether doing sleep hygiene or potential some melatonin or some sleep aids, we actually can get them to function better as well. And I think the key is to remember it is a whole spectrum. And we have, I can tell you, I have some friends that are physicians that I sometimes wonder, I think they're on the spectrum. So I think, they can function well. And I want parents to have a sense of hope that there are kids that, with early treatment and progression and can really help a lot of them function to almost normal levels, and they can do what a lot of them can do, is that, accomplish a lot of things. So I don't want parents to feel like it is a hopeless or helpless diagnosis. I think we have enough repertoire out there to improve, I think, most people. And I can't, obviously, if you have a history of seizures along with your autism and intellectual disability with your autism, the prognosis won't be as good. But I do feel if we can kind of treat around it, treat the seizures, treat this, we can definitely get them functioning overall significantly better. And awareness is the key to other specialties and other medical and health professionals.
I just wanted to thank everyone on behalf of SMA for your time. This was an absolutely wonderful discussion, and one that I think is needed and that so many people can benefit from. So thank you for your time.
And one other thing I just want to throw in there, and this is something that I think everybody needs to understand. If you have one patient with autism, you've met one patient with autism. It is very different. Everybody is different. And to simply put people into a small area and say they're autistic, they can't do it, that is a handicap. What they need is ability, not disability.
100%.
I want to thank you all very much for coming and joining us. I so look forward to our program at the end of the month, and it's going to be available virtually as well as live. And I hope we can get as many people to look in, because this is something that really pertains to just about everybody that sees patients. And so thank you all, and I look forward to seeing you down in Orlando.
Thank you so much for having us. We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's positions and training, please visit sma.org/PIT. And thank you for joining us.